All right, I think we're good to go. Good afternoon, everybody. Welcome in our Facebook Live audience here. We're going to be talking about the flu with Dr. Joseph Fascaldo, who is the medical director of quality at GBMC. Great to have you here, Doctor.
Thanks so much for having me.
Let's talk about the flu season. We got the football season, we got the baseball season, we got the NBA going on. Flu season starts when and it wraps up when?
Every year, the peak of the flu is slightly different, but generally we think from mid-October through April or May is when we're here in Maryland the most at risk for the flu. Usually, if we go on past the last few years, it's usually in midwinter when we get the biggest spike, but the sooner the better to get your flu shots because we just don't know. It could show up earlier this year.
All right, let me ask. I'm going to put you through a couple scenarios. I'm healthy. I don't need a shot.
So that may be true if you're only worried about yourself. Most people who are generally healthy will do okay. Even if they did get the flu, they'll be able to fight it off. But really, as I know, you're worried about not only yourself, but your family and others who may be more at risk. So it's really important for us as community members, as responsible community members, to think about the big picture and for all of us to get the flu shot so that we protect others around us. We get something that more and more people are getting familiar with the term herd immunity, but we've got to build that up in our communities so that the flu virus isn't floating around town.
All right, Doctor, it's October the 1st. I got plenty of time. No, September the 30th. Tomorrow's October the 1st. I got plenty of time.
We think that any time from now till you through the end of the spring, if you have an opportunity to get it, the sooner the better. So if you are in a healthcare setting or a office that has the flu shot, get it now. Don't wait. There's no really reason to wait. The sooner the better, and the more protected, the earlier we are, the better chance we get to that herd immunity.
I'm selfish. I don't have to protect my family.
Well, we really hope that the average Marylander gets an attitude where we're going to all help each other together through this. And there's lots of ways to protect yourself and your family. The first best way is to get a flu shot. It's really a no-brainer. Then the modern flu shots are so safe. There are a few side effects, but they're so safe that it's really a no-brainer to get the flu shot, and then do all the things that we've already been hearing about from other viruses that are around. Wash your hands. Be very careful about big crowds, and we know that wearing a mask helps as well, and it's probably going to help in the flu season as well.
Well, are the vaccines safe, Doctor?
They're very safe, and they've been studied extensively. People do get some side effects. I'm not going to lie that there's absolutely no side effects. Most common thing being a sore arm, a little bit achy, maybe a mild temperature, but nothing that is going to be remotely as bad as getting the flu or getting knocked over with one of these viruses.
Are they 100% effective? Will I not get the flu after I get the flu shot?
So I wish I could say they were 100% effective. Unfortunately, they're not. They vary from year to year, and it really depends. The experts predict what they think are going to be the most common strains here in the U.S., and they gamble a little bit, and they put these strains into the virus. Depending on how good our prediction was, has something to do with how effective our vaccines are, and the individual's own immune response also will play into whether you mount a good response to the vaccine. We know it's usually over 50% effective. Mm-hmm. Like I said, I wish I could say it was 100% effective.
Let me ask you this. You've been in the medical field for a long time. Well, I shouldn't say long time, but Doctor, have you ever seen the flu season getting a flu shot, a vaccine this year? It's as important as ever before. Why do you think so?
Yeah, so in the long time that I've been practicing as pointed out, this may be the most important year ever. We always encourage patients to get flu, but because of everything else going on, because of the possibility of people, particularly with underlying lung disease or other diseases that would put them at risk, we really want to try as much as possible to take other viruses off the table. Nobody wants to get COVID, but these other viruses can overlap. The symptoms can overlap. Some people can get fevers, a runny nose, cough, sore throat, and very similar symptoms to things like COVID. So the more we can vaccinate, the better we as physicians are able to make a good guess at what you might be experiencing.
Are there different vaccines out there? Should we be aware?
So great question. There is a standard vaccine. It's called a quadrivalent vaccine, which has 4 of the most common flu viruses. And that's the standard one. And most individuals can get that. There is a live, what we call attenuated, or it's live, but it's not really able to do damage. And that one is injected in the nose. And that's available and works pretty well for some people, but not for everybody. And then for people who are a little bit older, a little bit more experienced and mature, they will do a little bit better with a high dose vaccine. And this vaccine is designed specifically to give the immune system an extra bump. So it's going to give them a little bit of a higher dose of basically the same things that were in the regular vaccine. But sometimes people who are older need a little extra push to mount that immune response. The vaccines, the way they work, they rely on our own immune system to really respond and step up and attack, so that if they do see the real virus, then they're able to really jump on it. And I will say, another thing that people can do that we often forget about is really take care of yourself, because being healthy in general will help your immune system and will help you fight off and avoid getting the viruses. Things like regular exercise and diet, which everybody's sick of their doctors talking about, but these really do help in terms of boosting our immune system.
And doctor, run down the symptoms, like we need to know them again, but here they come. Run them down for us.
So it can be mild or it can be very severe, but anywhere in between, you can get things like runny nose, a cough, a postnasal drip, headaches. The classic flu has not only a fever, but this really achy, all over body ache. People say, I got hit by a truck, doc. And those, you don't want to get off the couch kind of feeling. Not everybody gets that, though. And the other important thing to remember is that getting the vaccine, while may not always prevent you from getting the disease, you may get a much milder version. And that's a victory, too, because you end up not nearly as sick as you would have been.
If I get sick, should I quarantine myself?
So great question. We know that these viruses are contagious. So you definitely want to use good judgment and avoid going to school, going to work. We don't have a formal quarantine process the way we do with COVID, but it's a lot of the same principles, and more exposure, the more people that you are opening up to the chance of the virus, it's a numbers game, and they have a chance of contracting it as well.
For those who are pregnant and watching this, should they go to get a shot?
Yes, so most of the OB/GYNs will highly recommend it, or as it is a safe vaccine in pregnancy. We don't want the fetus or the mother to experience any of the outcomes or the complications from getting a influenza illness.
When we have the coronavirus and the flu going on at the same time, will we be able to distinguish one from the other?
It's going to be a big challenge for many healthcare environments and in schools to try to be sorting this out, because there's so much overlap in the symptoms and the way people behave when they get these viruses. We do have testing, and we have rapid testing, and the testing is getting better. Thank goodness that we are going to be able to sort some of this out. There may be times when we're not 100% sure. We do have treatments for the flu, and we have some treatments for the coronavirus, for the COVID-19. So we're going to do the best we can as providers to try to decide who needs those, who is it going to make the biggest difference in, and will it change anything? Are you going to get better any faster?
Here's a stupid question. Can you have both at the same time?
You can, and you'd be unlucky, of course, but particularly the people who are most at risk, the people who already have lung problems or their immune system problems, are going to be at the most risk of getting two at once. But yeah, it is possible. So again, hand washing and being responsible, wearing masks, and getting the vaccine when we can.
Let me ask you that. You're washing your hands, you're wearing a mask, you're keeping your distance. Could that also fight off the flu?
It's certainly going to prevent more of the cases. And we are very interested to see what's going to happen with the flu season because Americans are doing a much different approach this year. And we're already entering the flu season with social distancing and with masking protocols in place. So we're hopeful that we're going to see a much milder flu season. People realize that every year influenza kills people as well. It's just at a much lower degree than the COVID, because it doesn't seem to be as severe. But it can be fatal, and we're hoping this year we're going to have a lot less of those because we're doing all these correct measures already.
Let me ask you, are you fearful that the coronavirus is just so big of a monster that we are dropping our guard when it comes to flu?
We worry about that because some people are reluctant to get vaccines in general, and I think that's going to be our best weapon. There are, and I will say, any of the vaccines that are appropriate for you at the age, including the plain old pneumonia bacteria vaccine, are a good idea this year, because anything you can do to protect yourself, like I said, the lifestyle things, because we really need to think about this as two parts. There is what we call the host, the people who are trying to fight this off, and then the invader, the virus. And we can't always control the invader, but we can control ourselves and make ourselves the host a very, inhospitable host to any kind of viruses, by boosting our immune system and doing everything we can to prevent it even before, get things revved up even before the virus has a chance to get into our body.
Of all the people you've come across in your life, have you met anybody who's never had a flu shot?
Absolutely. We have many patients, despite all the recommendations and good evidence, that will tell me and look me straight in the eye, despite my best persuasive pitch, that they will not get the flu shot because they're convinced they received it before and they came down with the flu. I disagree. It really can't happen. Again, you can get some mild symptoms, but in the big scheme of things, this is a lot better option. And I really advise people who are worried about the actual needle stick to kind of put that aside. It really takes a matter of a second, and you will benefit for months.
All right, doctor, give me the vaccine schedule at GBMC, the clinics going on.
So right now, if you are one of our health partners patients, so you're in our GBMC family, you talk to your provider and they will help you set up an appointment at our drive-through flu clinic, which is happening on, I believe, Monday, Wednesday, and Friday, I believe. That those drive-through is set up. And then if you also can get the flu shot in other spots and situations, if you're having in a procedure, We have another facility that helps people with that as well. But I really encourage you to get it. It doesn't matter where you get it. If you are an older person and you can't get the high dose one, that's okay. Get the standard dose. It's better. It's better than not.
Before I let you go and get back to your real important work, is there a fear that we could run out of vaccines, or is that not? We're okay.
So far, we haven't heard anything in terms of the production of vaccines or being a problem in the U.S. Occasionally, we in the other facilities get vaccines in kind of groups or in unloaded a group of vaccines or a supply, and then those run out and we wait for the next supply to come in. But don't worry about that. Go get your vaccine, and we'll make more.
Doctor, I want to thank you personally for doing everything you can out there at GBMC. Thank you for keeping us safe, and thanks for being the expert that we can rely on. And you filled us in on a lot of stuff that we should go out and get our shot this afternoon.
We appreciate that you're considering, and you guys are thinking proactively about our health. It's great to take a step forward and prevent things.
All right. You wear a mask, keep your distance, wash your hands, and we'll be safe. Thank you, Doctor, for joining us here on Facebook Live. Thank you, sir.
Thank you.